Guys, Doc Raj here from Move Athletics. Welcome back to the Human Performance Project. Today, we're going to take a look at how to treat your own elbow pain. I've been seeing a lot of this recently, a lot of lateral elbow pain, aka tennis elbow, or lateral epicondylitis. And we also have golfer's elbow, which is medial epicondylitis. So if your palm is pointing forward and you have pain on the outside, that's a tennis elbow. On the inside, might be a golfer's elbow, okay? Either way, we're gonna look at kind of capturing all of those tissues with a Voodoo floss band today. Voodoo floss is great because it allows us to address the sliding tissue surfaces there and restore the tissue's quality there and the function, as well as getting some ischemia to those tissues, cutting off the blood flow, right? And what that does is when we take this off, it allows a whole rush of new blood to come in, and it can be very helpful for decreasing pain and improving healing. So wrapping this up yourself can be a little tricky. So we always want to start off with a little bit, well, one, use a friend if you can, but if we have a little bit of extra slack here, that's good. Then we can just kind of wrap it around, and then you can use your chin to hold it if you need to, right? And then we put a little bit of pressure there. Now it's not going to be pretty if you do it yourself, and that's okay. But it's held pretty firmly there. Now I can start stretching it. When we stretch, we want to get 50% stretch. So if this is 100%, back off halfway, right? And then we want to get 50% overlap as well, which means that we're not going to go directly on top of it, but we're going to cover half of the previous wrap with each new wrap. I like to start below the elbow because those tissues go from the elbow down to the hand, right? Or the wrist, depending on which tissues we're looking at. So I like to make sure I capture those tissues in addition to getting up over the elbow joint where those tissues connect to the medial and lateral epicondyle. So the hard part here is wrapping this and getting it to stay up here. So my last wrap, I put kind of loose so I can easily tuck this in here and not lose it, right? So then you can just go through some active motion here, some flexion and extension, right? You can turn your palm down and flex and extend passively. You can do it actively. That noise is just the band moving a little bit, and then give a little bit of over pressure there, right? And we can turn up this way and do that, and we can just hang out there for 2-3 minutes. You can also put your hand down on a box here and put some pressure into moving into full extension, and then flexing a little bit there and full extension. So now when we bend our elbow, we get a little bit of stretch at the wrist there and extend. You can go the other way as well, where we're kind of flexing and extending. Now we're gonna get stretch when we extend, and then we flex and extend. Right, so spend some time there exploring and finding out what's kind of the most gnarly for you and hang out there. Remember, we don't have to get into a severe amount of discomfort. We just wanna get into somewhere that's maybe moderate, but tolerable. You shouldn't be having any pain phases. You know, your hand's gonna change color, and that's okay as long as you're not getting numbness, tingling, that kind of stuff. When you take it off, you'll get a rush of new blood, and you guys might have some like tiger stripes here, right? That's just from the band. That's okay, it's perfectly safe. The next thing we're gonna do is follow that up with some targeted stretching. So if we wanna stretch the tissues that extend the wrist there, right? For the lateral epicondylitis or the tennis elbow, we're gonna start with our elbow bent at 90 degrees. We're gonna grab our wrist, we're gonna bend it down and move it towards our pinky. And then we're gonna slowly extend our elbow until we feel a slight stretch in these tissues through here, right? And we wanna accumulate about 2 minutes in that. That could be sets of 30 seconds, sets of 20 seconds. You can go 2 minutes straight through if you want to. Doesn't matter, we just wanna accumulate that. And then if we're looking at the medial side here, we're gonna do just the opposite. We're gonna start in the same position, but now we're gonna extend the wrist and then move towards your pointer fingers. Extend and move towards your pointer finger, and then extend the elbow there and hold, right? So you get about 20-second holds, 30-second holds, doesn't matter. Go up to about 2 minutes. Like, tag a friend that needs this, share it, try it yourself. Let us know how it goes for you guys, and we'll see you next time on the Human Performance Project.